Well, good afternoon, everybody. Thank you for joining us. My name is Brian Lewis. I'm the president of KidneyCAN. I want to thank you all for joining us from around the globe today. We have 161 registrants from 31 states and 16 countries here for today's program, our town hall called What I Wish I'd Known. And we're going to be joined by three great panelists from across the country, as well as one of the leading oncologists. So let's get started. But first, thanks to our sponsors, BMS, Aveo, ASI, Exelixis, Genentech, and Merck. We couldn't do it without you. So real quickly, Meryl Uranga, an 8-year kidney cancer survivor and passionate advocate, now serves as a legislative voice and a community liaison with KidneyCAN, joining us from Atlanta. Also, I think a congratulations on a cancerversary, I believe. We'll hear about that later. Second up, from Philadelphia, Glenn Sykes has been living with kidney cancer since 2010. In 14 years, he's dedicated 15 and is dedicated to supporting patients through representing their voices in clinical research design and education on topics of importance for all patients and caregivers. Really appreciate, Glenn, all that you do. Next up, all the way from Chicago, Leah Christoforidis, a mother of 4, was diagnosed with a rare kidney cancer during pregnancy and now advocates for education and empowerment in the kidney cancer community. Thanks, Leah, for joining us. I know it must be busy for you as a mom today, so thank you for that. Really excited to introduce one of the, I think, patient community favorites out there in the great state of Ohio, all the way from Cleveland Clinic, Dr. Moshe Ornstein, medical oncologist, nationally recognized expert in kidney cancer. Really appreciate your patient-centered approach, leadership, and clinical research. Dr. Ornstein, the floor is yours. Take it away.
Hey, good afternoon, everyone, or good whatever time it is, depending on what city, state, and country you're in. It's a real pleasure to be here, and I appreciate the invitation to moderate today's session. We really want to keep it among the panelists casual. We'll have back and forth discussions. We hope you'll feel comfortable sending in your questions as they come. And we're split up into 4 different themes with the hopes of staying on time and finishing within an hour. So I'll sit here just to moderate and then really pipe in when I feel like there's something I can add. But I think the bulk of the benefit in terms of what you gain from this will come from the other panelists who are patients who, doctors sometimes say, I can imagine how difficult this is for you. But the reality is that we're not supposed to say that because we can't. So hearing it from the mouths of patients themselves is probably the most beneficial thing. So we're going to start our first theme that will take us about the next 10, 15 minutes we'll spend on it, is really just getting oriented after a diagnosis. There's the C word, there's nothing really in life that can prepare a patient to hear that they have cancer. And, I've had my own cancer scares. I may have some patients on here who may know about it. And I remember when I heard that I had a lump somewhere in my body that was biopsied and came back suspicious for cancer, my world kind of fell apart. And I basically spent the next few days crying. So we'd like to start there, really getting oriented after the diagnosis and what's it like? What's the reaction to that first message? Because some patients feel like if they're stoic, then they're doing the wrong thing. If they're crying, they're doing the wrong thing. If they're just afraid but don't know what to ask, then maybe they're doing the wrong thing. So let's hear from the panelists. I'll start with you, Meryl. Your first reaction when you heard about the diagnosis, how did you take that in? What were you feeling? How did you kind of process this?
For me, it was utter shock because I was incidentally diagnosed with, I had another condition. I was having appendicitis in an ER, and I had symptoms that led me to the ER, but absolutely no symptoms that led me to think that I would be leaving that ER with a cancer diagnosis. It was just found in a scan that was determining what was going on with my abdominal pain, but I had not a single indication or clue that something else was wrong with me. So there was a lot of shock. And I would say because of the situation where I had to immediately go into surgery, have an appendectomy, I would use the word chaos to describe my mental and physical state at that point. But then, that kind of swiftly turned into shock, depression, fear, sadness, pessimism, just all kinds of, life-changing, turning my world upside down emotions. And it took quite a while to get my footing. Recovering from the surgery and then having to figure out what to do next was also a huge burden. So yeah, there's a lot going on there, and you really have to give yourself a lot of grace in retrospect.
Yeah, I mean, it sounds like there's a range of emotions, and then at some point you're saying there are all these emotions, but I also have to figure out, how am I going to take care of this? What am I going to do next?
Exactly.
Yeah. Glenn, curious on your end, did you feel similar? And Leah, please jump in right after Glenn speaks and share your experiences as well.
Absolutely. I was stunned. I was stuck. I felt stuck. I felt like I was completely in the dark. Real briefly, the circumstances was I had arrived in London on a business trip and went to the emergency room that night with an incidental finding. Was put into a ward the next day, and I remember what they called the consultant in London coming by and telling me that they suspected it was carcinoma, and me asking, well, what is a carcinoma? Not even having any sort of awareness of what that even meant. I'm thinking to myself, how could this happen? I had pragmatic concerns. I was in London. I was living in Asia. And my hometown is Philadelphia. Do I go back to Asia? Do I stay in London? Do I go to Philadelphia? So I really felt really stuck about that. I had a health system in London. I had no entry point into the health system in London nor in Asia. I had been, very healthy, so I didn't really have a lot of experience in the health systems there. And I wasn't scared at that point because I didn't have anyone scaring me. The scare comes from other people, your family and your friends, who sort of get that ashen look on their face when you tell them what your diagnosis was, and then you think, oh, I am scared. So if I could give a graphic, it was me in the dark with a big question mark over my head. So I really just had I was stuck and didn't know what to do. And I had a friend that unstuck me and said, you got to come back to Philadelphia. That's the place that's familiar to you. It was a great piece of advice, and that unstuck me and set me sort of on a different path.
Yeah, I had a patient, actually the father of a child who had cancer, was speaking at an organization that helps patients. And he said a new cancer diagnosis is like living in a foreign country and being woken up in the middle of the night when you're still jet lagged and being spoken to at that time in a foreign language that you don't understand, with directions and sort of at gunpoint almost.
Yes.
So it's the entire range. So Leah, on your end, I just want to shift gears quickly to get a handle on, we're going to talk a lot about sort of the treatment course and different aspects, but as you think back to when you were first diagnosed, what's one piece that you wish you had known at that time?
So I think looking back, the one thing that, I really wish I had known right away was it's okay to ask a lot of questions. It's okay to push back. It's okay to challenge a little bit of what you're hearing. There are a variety of ways to approach the cancer diagnosis. There's different treatment options. At least in my case, there were different treatment options. And it's okay to figure out, the pros and cons of all of them. It's okay to ask the questions to multiple people and to really dig in. In my experience now, after 5 years, every step of the way, there has been no one right course of action. There's been several okay options. And so I think it's really important to flush all of those out and consider options and be honest with your oncology team or your surgical team what your goals are and what you really want to see happen. Because the more patients participate, I think the better answers you can get from your team, because you can align as to where you want to go and how you want to get there.
Right. I see the same thing. Advocacy skills was on my list of what I wish I had. And you have to learn those over time. I was very much like in the school of, if the doctor says it, then it must be right. You had to learn over time how to be a better advocate for yourself. And I don't think, it's on my list of what I wish I'd known, but I don't think, December 10th, I get a diagnosis, and December 11th, I've become a better advocate for myself. I think you sort of have to learn that behavior. It made a big difference for me.
It also, just to add to that, I think it's very difficult at first to do that. It really is. And it's also very difficult to tell your story multiple times, kind of remind yourself sort of where you are as you're sharing your diagnosis with a new potential team member. But it does get easier over time, and you will get more comfortable doing so.
Yeah.
So Meryl, we've heard both from Glenn and from Leah about, kind of being more in control. And I really do hope that's a theme that comes up again and again. It's really the primary theme I've been thinking about in reviewing notes prior to this meeting. But what are some actions practically? Like, let's say you get a message on Smart Patients, or somebody calls you because they know that you're an advocate and they're just flustered and going on and on. What would be your message to that person at the time of a diagnosis, looking in hindsight? What would you tell them?
My message is, without a doubt, unequivocally, take your time. My biggest regret, looking back, not regret, but like if I had to do it all over, and what I would counsel people to do is take your time. Your initial reaction is, get this thing out of me, get this going, get this moving, get things started. Looking back, I made some decisions that I wish I had taken more time with. I didn't have the bandwidth or the wherewithal to do the research that I needed to do in that, fight or flight state that I was in. Besides having surgery and having to deal with what was going on, and my friends and family saying, don't Google this, don't look this up, don't do it, it's not pretty, you don't want to see all this. And so I felt like I was in the dark, but yet being pushed and rushed into doing things. And if I were to do it again, and I had the ability to help someone in my shoes, the same shoes I was in at the time, I would say, take your time, get some footing under you, relax, do your research, find support, find information, and then start making decisions. I made some decisions that I wish I hadn't, to be quite frank. I do have a few things that I would have definitely done differently, knowing what I know now. And that was probably the number one message that I would like to portray today, is just take your time. This thing has been going on for a while. You just now found out about it, but nothing terrible is going to happen tomorrow. You can start, digging in and getting some footing underneath you before you have to start making these life-altering decisions.
So slow down, and you have more control than you think. I do have, sometimes patients will come and they'll bring a list of questions, and they'll say, you probably hate that I Googled all this. And I say, no, for me, a well-informed patient, I try to take their notes and write on them if I can. But I think for sure, slowing down, it tends to be pretty rare where it's so serious that somebody is whisked right off to the emergency room. And that does to the operating room. It does happen, but usually there's time. We have a tumor board. We're talking to other specialists. We're setting up second opinions, which we'll get to in the next section. So usually there is some time, but there is sometimes where, a patient will have, let's say they're not fortunate enough that they live right near some big specialized center. So they have different people involved in their team. And part of getting control is saying, I have multiple team members. How do I balance this? And this was a question actually that we got from Michelle in Florida. And I'll just pose it to the three of you, and anyone can jump in. What is the best approach to having your general oncologist work with your kidney cancer specialist if you don't live right next to the specialist? We're saying slow down, Google, research, find the right doctors. But if you have kind of two separate teams, how do you navigate them communicating while you still feel like you're in control?
So I can take that one because I work with a team locally in Chicago, and I also work with a team in Boston. So that team does have to communicate. So I see a kidney cancer oncologist in Chicago, but I also see specialists for the rare kidney cancer type that I have. I have a translocation RCC. And so I think the best way to do that is really be honest with both parties that, here's what I'm doing, here's my approach, and here's why. And I even made an email introduction myself between the two teams just to sort of bridge that gap and get things rolling. But I think the more straightforward you are about why you're doing this and what you're trying to accomplish via this path, I think it goes a long way, because ultimately, really everyone is on the same team and does want to work together. But they have to know, what's in the mix and what's happening.
Yeah, Leah, I'd imagine, I haven't been in that situation, but one of the things I would say is that your general oncologist or your community oncologist has to be open to that, right? And think it's to believe you that it's in your best interest, and wants to play with others as well. So I would think that would be the starting point. And if you don't, I would guess you need to find an oncologist that's open to those kinds of things.
Yes, it's true. Although I've never had an experience where in talking with an oncologist that they weren't open to a second opinion or a dialogue.
Yeah.
So I would think that's probably rare, but I'm sure, it could happen.
Leah, can I actually ask you about, you said that you have two teams communicating. How did you go about finding a specialist to work with your local team? And how would you, again, give advice to someone who's recently diagnosed who might also not live next to a specific center? And how would you advise them of going about finding a specialist to be involved in their care?
Sure. So the first thing I did do was really dive in. I mean, I know everyone gives you the warnings about the internet, but sometimes you just have to go there and you have to find out, what it is you're fighting against and who might be able to help you. I also started attending some of the kidney cancer oncology conferences. And I know that that's not necessarily an option for everyone, but that was certainly very helpful for me to show up at those meetings and start talking to people. But the one thing I think everyone can do, and from home, is to get involved by attending online meetings such as this, volunteering with some of the organizations, and meeting other cancer patients, especially kidney cancer patients, because the group here is really well connected and really well networked, and everyone is so supportive of each other. I found that they're really, no matter what challenge I'm presented with, I can find someone who has, beaten that or done that. So I think it does really, really, really help to build that community, if it's via smart patients or just getting involved. I think there's a variety of ways that you can connect with other patients, and that makes a big difference.
Yeah, and I think that's a great segue to talking about our second theme, which really is navigating care and self-advocacy. One of the, I'm not sure, Meryl or Glenn, if you've had experience with this, with second opinions, but it's very interesting how patients are often concerned that they're going to offend their doctor if they either bring more information or print out something they read or ask for a second opinion, as if that's an attack on you as a physician. So have either of you, Glenn, Meryl, I see you nodding your heads about second opinions. It's really a two-part question. One is, how did you navigate that discussion with your primary oncologist or urologist or whoever was taking care of you? And then how did you go about finding someone to see you as a second opinion?
I can chime in on this one. I had no issues whatsoever with my primary oncologist when I told him that I was seeking a second opinion. He was completely in favor, very helpful in working with the second opinion that I got. And I think an important point to make here is that everything for me tied back to getting involved in the community. Once I got involved with smart patients in particular, I started to really understand that I was in the wrong place. I was in a community setting. I had my surgery initially and my initial treatment all through a community hospital, because when I was in that state of shock that we talked about earlier, I was making decisions based on, well, this is close to home. This will be easy to go to. They have good parking. I mean, I was thinking very pragmatically because I didn't know any better at that point. And then when I got involved, when I had the ability to pick myself up and start actually digging in, I learned that I was in the wrong place. I needed to be I live in a big city. I have a very well-renowned cancer center in my backyard. Sure, there's bad parking. Oh, well, too bad. I've learned how to navigate that over the years. But I was able to dig in and find out, one, that that's where I needed to be. Two, that a second opinion would be super valuable. And who that a second opinion came from was extremely important too. It wasn't just, picking a name out of a hat. I had to find out who were the Uber specialists, where should I go, and it would just, there was a lot of information, but I pinpoint the fact that the community of smart patients, and I love that name, and I will always love that name, because we are generally all of the same mindset of getting involved in our care, of becoming educated, becoming advocates for ourselves and others. And that's where everything turned around. And I found the second opinion process to be very smooth. And I think there's a very strong sense of community among the providers in kidney cancer, in the GU world in general. So there's a lot of mutual respect. I had no issues at all with communication and cooperation between the two of them. And it was a great experience.
So did you just tell the team you were seeing, hey, I'm going to look for a second opinion? How did you, because I think some of this is the unease that a patient is super vulnerable, totally not yet in control, and then saying, hey, by the way, I'm going to go check in with Dr. So-and-so around the corner. How did you have that discussion?
I was facing my first systemic treatment. It had been about 1.5 years since I was diagnosed, and up until that point, I had just local treatment. Nephrectomy, lobectomy, some radiation, targeted radiation in the brain. And then I had to make a decision based on progression that I had to start systemic treatment. And I knew that that first line was so critically important that that's how I addressed it. I don't feel comfortable making this decision based on one opinion, and I might even get 2 or 3. I want this to be the right move. And it was support all around. I never felt at all like I was offending anybody or stepping into weird situations. And, there's that perception possibly that there may be some like ego clashing, and it just wasn't my experience at all in this community, in this situation.
Yeah. I was going to jump in and say, from the very beginning, I think I saw 4 surgeons before I got operated on. But my reason then was hoping that one surgeon would say, oh, we don't see any problem. Goodbye, go have a good life. So that didn't happen. But I think that from the beginning, since I had that from the beginning of seeking out other things, first of all, my oncologist herself seeks other people out, which is a good role model for me, completely open to it. And I think probably Leah and Merle will agree to this. You go into this thinking, at least I did, this is science, everything's scientific, and it is science. But you realize there's a lot of room for art in there. 1 decision, 2 decisions, people will look at it differently, you get the information. And once you sort of accept that fact, then you see really a good motivation for going out and getting second and third, 4th opinions, as I have. Some of it's been circumstance. I've been in trials, had care, in another institution that didn't offer this particular treatment. So I've seen other doctors through as a result of that process. And at every inflection point, I think in my care, my disease advances, that I take as an opportunity to go out and get other opinions, because you can sometimes get different answers. Ultimately, you have to make the answer for yourself. But I think that's really valuable in terms of being an advocate for yourself. And I think I have an oncologist that is, part and parcel and partner with me on that process.
Yeah, I mean, I would say I've probably said this 1,000,000 times to patients that any oncologist that is afraid of you getting a second opinion is the oncologist you should be afraid of. Yeah. Meaning, or the way I the way I phrase it backwards is the only oncologist you have to fear is the one who's afraid of you getting another opinion. At the end of the day, and I would say it time and time again, that, I've advocated for my patients, especially if there's disease progression and something unusual happening, say, hey, we've got a place around the corner, we've got a place 2 hours away, we can get you to another state. But your oncologist or urologist should not be offended by this. And if that person is offended or not willing to work with a specialist, then it might be worth considering whether you're seeing the right person for your care. So someone write in the chat that, finding a specialist, finding a doctor, yes, part of it is about the medicine, but part of it is about the fact that hopefully this is a very long-term relationship. And it's a relationship with ups and downs, hopefully more ups and downs. But there are going to be times during the relationships that's a little bit more bumpy. And if something as simple as just hearing another opinion for a life-altering diagnosis that you just received is not being accepted well, then you might want to reach out to Smart Patients or KidneyCAN and see how they can help find someone. I want to move a little bit from so we've spoken about sort of that initial shock and the initial emotions, the finding the medical team, the finding a specialist team, but now very practically, you're coming to these visits and there's so many questions to ask and so much information. What advice we'll start with you, Leah. What advice would you give for someone planning their first visit? They're going to see, let's say they're diagnosed with metastatic disease and they're going to see an oncologist for the first time. What advice do you have in terms of organization, who to bring with them, just prepping for that first visit?
Yeah, I think that first visit is really the scariest visit. I would definitely recommend bringing someone with you, and maybe even two people, and for a couple of different reasons. I think as the patient, you're hearing one side of the conversation, but your caregiver or whoever is with you is oftentimes hearing something a little bit differently, and they can also take notes, because as a patient, I think it's impossible to take notes, especially in the first visit, maybe follow-up visits, but you've got a lot of emotions running through you. And so you need someone who can be a little more level-headed and actually jot down the notes. I couldn't even remember the different types of combinations that were being offered to me. I had no idea, it was, I don't know, there was a pill and then there was something else. And, it was just all really a blur. So you're also going to need, a moment to then, after the visit, kind of digest to go back and understand. And I think, it's important to have someone to talk with and talk to about all of this, who's been there. There was, one time I went, I even had someone on the phone. I had a friend with me, and then we dialed in a second party who could sort of help troubleshoot this and also ask questions. So I think, one thing that is really important, and I think this stems through all the topics we've touched, is it's also okay to ask for help. Don't be afraid to call on people to help you. I know, from the patient side of things, we get a lot of offers to help, and we get a lot of these, oh, I can do anything, I can do anything for you. Think through what you might need. One thing that was really helpful for me is when we were talking about setting up first visits or setting up second opinions, is I had a family member who made calls and set these visits up. That really went a long way, because sometimes it's just the barrier of looking for that email address and the intake that you don't want to do. Oftentimes facilities will allow a caregiver to set up appointments for you, and that's a huge help.
So bringing someone, taking notes, and basically having kind of strong advocates or people there. I tell patients that usually for every mile or so they drive away from the cancer center, people tend to forget approximately 10% of what's said. So if they're 10 miles away, there's not a lot that's remembered. And that's through no fault, or not saying that anybody's not smart enough to absorb the information. It's just, it's all mush. So I definitely think having somebody else there is incredibly helpful. Curious to hear, Meryl, Glenn, what about you in terms of prepping for whether it's the first appointment or subsequent appointments? How do you stay organized? Who do you bring with you? What advice would you give?
I was hyper organized in the beginning, like Leah said, brought that friend with me, took lots of notes, prepared all the questions I've done. I would say as I progressed through this, I have become probably less organized. Also, I see my doctor once a month because of my infusion visits. I see someone on our team. So there's less time for things to fade. Everything's pretty fresh. For big appointments, I still bring a friend. And one thing, Dr. Ornstein, I don't know whether I mean, you have to ask permission, right? But one thing I did in the beginning was record my appointments. Always ask permission. I've only had one doctor say no, and that's fine. I don't argue with that. But recording that appointment allowed me to settle on the the 10% fade factor as you drive away. And even for the person that's there, I think the talk comes really quickly. It's hard to sometimes get notes. Sometimes you're like, now what did they say, this or that? And so the recording did help. I don't do that now, but in the beginning it was really important to do that. So come prepared with some questions, come prepared with help. To Leah's point, be introspective. What kind of help do you need? And I found the recording very helpful to me.
Yeah, I think we're generally pretty happy for people to record if that's what they'd like. I have some patients that like to record, some patients that just want to take notes. Sometimes we set up a FaceTime with a family member who can't be there. But I think the theme from this in terms of getting to your appointments, there are times when things get into a very smooth routine, but certainly for those changes in treatment, initial diagnosis, first appointment, definitely having somebody there to be your eyes, ears, and memory is going to be critical.
Yeah.
On the theme though of navigating care and self-advocacy, one of the questions that came through, this was Lisa from North Carolina, was, do you have any tips for dealing with insurance denials, especially for treatments that are considered standard of care? I don't know if any of you have had that experience. If you have, please jump on. Otherwise, I'll share how I feel about this.
I have not. I fortunately have not had any experience in that area, so I can't add much there.
I've had a little bit, not so much with things that are considered standard of care, but things that were a little bit more outside of the box. I did find I was doing some DNA tests and ctDNA and some additional DNA tests on the tumor. And I did reach out to the organizations that were providing the testing, and they did have financial assistance programs to help patients that had denials. So that's one avenue, but I think that might just be in certain circumstances.
Yeah, I think just asking the medical team to help support you. Again, I would just be upfront and say these denials, there's generally appeals that we can do on our end. Sometimes it's multiple levels of appeals. You can ask to speak to that person's supervisor, whoever they're on the phone with. Sometimes it does come down, unfortunately, to just being a squeaky wheel and, just pushing and pushing. But it can be, I would say that one of the more frustrating parts of oncology is not being able sometimes to get the right therapy to the right patient at the right time because of an insurance company. So you really need to have the medical team first and foremost push for, on your behalf. And then you can reach out to organizations as well. One second. So, we spoke about the initial diagnosis, the finding your team, finding the specialist, making sure they're communicating. One of the things that often gets overlooked and usually sort of drops down on the list of what's important for a patient, even though it is tremendously important, is relationships and emotional health. This essentially the mental well-being of patients as they're going through this. A cancer diagnosis is not just a diagnosis for a patient. The patient might be at the center, but there can be a partner, a spouse, a child, a parent, friends. We've had cases here where the room is full of loved ones. So Meryl, I'll start with you. If you can just share of how did your diagnosis initially impact these relationships? How did you communicate about your diagnosis with your loved ones? And what advice would you have for those, newly diagnosed or early on in their journey?
Yeah, it was tough. I have 4 children. They were in various stages of development at the time, mostly adults, but going through their own lives, and it was extremely difficult to feel like I was burdening them at that point as they're becoming young adults and doing their own thing, school, starting careers, relationships of their own, et cetera, and having boom, this comes down. And I'm on my own. I'm a single person. And so I relied on my kids a lot, along with my friends. And it was a very difficult time. I was very fortunate. And as soon as you mentioned this topic, the first thing that popped in my head is how fortunate I am that here at Emory University, the academic center that I received my care, that there's a whole department for oncology, psychiatry, and emotional mental health support. And I took advantage of it. It took me a while to really feel like that was like where I needed to go. I was so focused on the medical aspects of it that I was kind of leaving that part behind, but it was catching up to me pretty quickly that I needed some support in that area. And it's been 8 years, and I still to this day regularly see the staff person, and it's interesting because she is a psychiatrist, but she is focused totally on oncology. She's part of the oncology world of the university, and it's been extremely helpful, and I highly recommend, if that resource is available to people, to take advantage of it because it's unique. I tried going to some other counseling first. That's a good point to make, and they didn't get it. It's not the same understanding of what you're dealing with as somebody who's focused on that all day, every day, and that's their job. So I recommend that. And, just staying close to those who are there to support you. People who are listening to me right now that are moms understand when you're a mom, you don't want your kids to have to help you. You want to help them. And so that was a tough pill to swallow for a while, but I did. Like my oldest son, when we were talking about coming to appointments and having that second ear and everything, he stepped in, took me to a lot of things, and was that second set of ears for me. And it was super helpful. Now, as the years have gone by, I don't really need that kind of support. I may again, if things change, or when things change, I don't know. But as things have stayed stable and steady for me, I don't really count on that as much, but it surely was important back then. And it kind of set the tone for me to pull myself up and get in a more healthy mental state for dealing with everything that was coming down the pike.
Yeah, that's a great answer and likely to be helpful for many. I'm going to rephrase the question a teeny bit for you, Glenn. If you can mention, what's the one thing you wish you had known when you were first diagnosed about the impact this would have on your mental health and your relationships with loved ones?
Well, I guess I mean, if you had just asked me right then, did I feel like this was going to have this would be a thing to deal with in my relationships with my loved ones and my family? The obvious answer to me would have been yes. I think what I didn't know was how important it would be to be introspective. Leah mentioned this. It isn't something that I was particularly conditioned to do, but I have found every minute that I've spent being introspective and thought about my needs and what emotions that I'm feeling. And like Merle, I had some professional therapy help to do that. So that was money well spent. But that time spent looking inward, thinking about how I'm feeling, what my needs are, and being able to translate that into articulation has really helped a lot with those relationships. So I think I would have, in the very beginning, known that was going to be an issue, but I didn't necessarily have the tools to think about how to navigate that. And it sounds really silly because you don't need to be a cancer patient to understand the value of introspection, but maybe cancer elevates the importance of that, because people, your friends and family want to be helpful. They often don't know what to do. So if you can help them along by saying, I remember sitting in a therapist appointment saying, I'm so mad because they didn't do this, they didn't do that, they didn't do that. And her just turning around, and saying to me, well, did you let them know what you needed? And me thinking, oh man, no, I didn't do that. So I could have probably saved myself some money if I thought about that. But it helped to think about that. I have found as a long haul patient, I feel like I'm facing some different issues because I'm here 14 years later, and there may be some long haul patients on the chat today. I have been really fortunate from a treatment perspective, not cured, but not ill from treatment, that people forget that you have cancer. I never forget that I have cancer. And, I do find myself internally sort of thinking, I'd love to shout out, I still have cancer. There's no cure for my cancer. I'm not cured, but people forget about it. And I think that's an issue that I think I'm noodling with right now, is sort of how to, that issue as a long haul patient, how do you get people, it sounds silly, but not to forget that you have cancer.
Yeah.
Yeah.
It's so powerful to hear, because again, with many of the treatments, and in so many ways, kidney cancer for many patients can be chronic. Doesn't mean they're not on treatment, doesn't mean they're not suffering from side effects, but often patients don't lose their hair like those who go on chemo, or their skin might still look the same and they seem like they're okay. But there's been a lot of data coming out recently, how many hours a day patients think about their cancer.
Yeah.
And it's just incredibly powerful to hear from you. Also, to let patients know that it's normal to think about it that much.
Yeah. There's the TV cancer patient. That's what people think. And if you don't look like the TV cancer patient, losing your hair, puking, all those things in it, people who are treated for kidney cancer do have some of those things. I think people just sort of forget.
There's very specific perceptions, I think, in society about words like remission or cure or you beat it, or that they don't understand.
Yes.
I find over and over and over that people just don't understand the concept of, yes, I have stage 4 cancer and I live with it on a chronic basis, and I'm not cured and I'm not in remission and I didn't beat it, but I'm living my life. I'm living my life and I'm managing what I need to manage to keep doing that. And so it's a little bit of a wedge sometimes in people understanding that about who you are. And I think that can have a mental health impact as well.
Yeah, there's there's this magical timeline, I think, from 10, 15, 20 years ago of 5 years. If somebody had cancer and they were still alive 5 years later, by definition, it meant they were cured. And it's so different these days, as cancer has been turned into a chronic condition for many patients, where it might be 5, 10, 15 years on therapy, off therapy, switching therapies, and that mental burden never leaves the patient, but it's not always recognized by those surrounding them. Just one last quick point that maybe we can help others with about relationships and mental well-being. This was a question that came from Howard in New Jersey. Are there support groups or communities you'd recommend, not just for patients, but also for their caregivers, to help with the relationships and mental health? Have you reached out to any specifically? I know, Meryl, you had mentioned kind of within your cancer center, but maybe Glenn or Leah, have you reached out to anybody outside?
We talked about a little bit about this. I don't necessarily I think of it as a form of support, but I think it's a really particular form of support. We've talked about Smart Patients on this call. That was a group or predecessor organization that I found about 2 months after diagnosis. It's been an invaluable form of support. I would say it is more medically oriented, although emotions certainly come into play and people are willing to respond and be supportive to people. But I find the education and the knowledge I get from that a form of support, really valuable form of support. As terms of other support groups, like Merrill, my institution does organize support groups. I was in initially a young adult support group because they didn't really have one where I had my surgery. That was actually great to be with these young people, far younger than I was. But since then, I am in a general cancer support group. It is helpful. There's some similarities in terms of where our stress points are, where we are in our journey. So that's another thing. Probably a lot of institutions do have social service departments in which that would come. So those are my tips. Smart patients, check with your institution. And I think there's some national organizations too, and I can't think of the name off the top of my head. I could see their logo. I went to it, just wasn't me.
But I think, go ahead, Marilyn.
No, I just wanted to add that, I agree that Smart Patients is a great source for information in terms of medical and health stuff, but the tie into the mental health part of that is so powerful, because the empowerment that you get when you start learning what's going on there makes all the difference in how you go forward. The confidence, the knowledge and everything,
Yes.
That not more than anything, the people that I met, some of them are on this call right now and have literally changed the course of my life and my disease. So that the mental health aspect of that cannot be overstated. It is just a powerful combination of all the information plus the support. I'm like Glenn, I'm not really sure of any names of other organizations. I'm sure they're out there. There are a lot of Facebook groups.
Right.
The internet's a big place, but Smart Patients is unique because you get everything there. And,
Judy Nicholson, I completely forgot about that. Judy
Nicholson,
Nicholson does have a regular group through Joel Stern. So Judy Nicholson Kidney Cancer Foundation. If you Google that, you'll get to it. They have a regular monthly meetup. I think it comes from a Facebook group that exists, but there's a face-to-face meeting on a monthly basis that is targeted, I think, primarily to patients living with metastatic cancer. But that also, I think, is, I find that to be more oriented towards emotions rather than necessarily medical, like I would think of Smart Patients.
Right. But I think, what's so interesting about this is, when we talk about medical resources, we're always able to rattle off like 5 off the top of our head. And when we talk about finding help for people on a, psycho-emotional level, it's like, wait, where do I go for that? Right. Yeah. Jump on, Leah, and then we'll move on. Let me just hear.
Oh, sure. I also wanted to add one organization that I've participated in is Immerman's Angels. And I think this is especially important for those that maybe have a rare kidney cancer type, because they can match you up with someone that has your exact type of cancer. And also for some of the younger patients, they can match you up with someone who, falls in your age range. If you're diagnosed in your 20s or your 30s, they can match you up with someone young. I've found that to be a really, really wonderful organization, because I have these one-on-one relationships with other young patients that have exactly the same type of cancer that I do. And we can really talk about anything. I mean, I think the fact of the matter is that the cancer diagnosis is very isolating. You're different than, everybody else, or at least it feels that way. But the truth is there are a lot of others that feel the same way, and connecting and being able to talk about that, I think really, really, really helps.
Yeah, that's great. And, just before we move to the lightning round, where you'll all get a chance to kind of give one key takeaway, I have a question I'd like to hear from the 3 of you. You're all up here. You've all gone through a lot in terms of your kidney cancer, and you're all involved and smiling. How do you stay optimistic and hopeful during this journey?
Well, I'll start off just by saying that, my involvement in advocacy is what helps me the most, because I always feel like as long as we are active advocates and we are doing the work and pursuing the cure, and there's hope. There's hope. Look at us, the 3 of us sitting here today. We're we're moving along. We are living our lives and kicking that can down the road, because the next treatment may be the one. We don't know. So that really, really inspires me and pushes me and puts me in the mindset that I need to be in to stay optimistic, because I feel like we never know what's coming. And so, but we have to work at it. And, you know, right now with our political environment and everything, I don't want to get too much into that, but we're facing a lot of challenges there. So optimism is going to become more and more elusive as we're fighting more of a battle to get this research done. But as long as we keep fighting it, I'm going to be optimistic.
Yeah. I'm probably naturally optimistic, so that helps. I realize not everyone has that starting point. Absolutely agree with Meryl. Keeping abreast of research, being involved in the research world gives me a reason to be optimistic. In the time that I've been diagnosed, December 2010 till now, everyone realizes that landscape on the treatment side has just changed completely from December 2010, when they could do this or that, and that was pretty much it. So that makes me feel good. I feel good about the future as long as that research continues to get funded. You got to look up once in a while and think about all the things you have to be grateful for. I think that's one of the changes. You talked about how I've changed. I think I spend more time looking up and take account for all the things I have to be grateful for. And there are many, which I think helps as well. And I also try to channel my energy into looking ways that I can help as an advocate, as a research advocate, things like this, patient education. And I think that I get a really good feeling out of that. So when you think about optimism and good feelings sort of being connected, I think that helps me as well.
Right, Leah, what's your tip for optimism over the course of stuff?
So I would say a couple of things, and it really echoes what both Meryl and Glenn have said, is getting involved has really, really kept me optimistic, and advocating and getting to know other patients has really been inspiring and keeps me optimistic. The other thing is, there's a perspective switch. It's not about what's to come, it's about what we've accomplished and what we're doing today, and just really getting the most out of every day. And it gives me a lot of confidence to know that we're really, really living in the moment, and we're really, really taking advantage of all that's in front of us here today, instead of worrying about next year.
Yeah, amazing answers. We're just going to do one quick lightning round before we close up. We'll go in the reverse order than I think we have been going. So we'll do Leah, Glenn, Meryl, and then I'll chime in. But the title of this was One Thing I'd Wish I Had Known. So in 30 seconds, for each of you, if you can go back to when you were first diagnosed and thinking about your experiences over the years, one thing you'd wish you'd known that might help others.
So I would say there's really no right answer. So don't be afraid to push back. Don't be afraid to explore alternatives. Don't be afraid to get a second, a third, a fourth opinion, because even if those opinions are the exact same thing, you will learn something different, because everyone's going to give you a different reason why, or everyone's going to highlight different sort of risks or opportunities. So you have to flush it out, and you have to be willing to, push a little bit.
Excellently. That probably would have been the answer I wish I gave. But the answer I'm going to give is this, that I wish I had a fuller picture of this disease, and sort of impossible to have until you have the disease, and I think that would help me, particularly to see examples of long-term survivors. Probably because, I watch TV, movies and things like that. And that's the image I had of cancer and cancer patient. And that's the image I had of myself immediately. So I think having a fuller picture of the disease, that would have helped me tremendously in the beginning, just having something different in front of me rather than what I had in my head, which was the last person I saw on TV that had cancer.
My answer is going to sound very specific and very personal, but it ties into a bigger concept. I wish I knew that having brain mets does not mean that you're automatically a goner. And I wish that I knew that one of the most world-renowned oncology urologic surgeons was in my backyard. I didn't know either of those things at the time, and it ties into the fact that I wish that I knew I had time, that I wish I could have taken my time, and I mentioned this before, and had enough of myself together mentally to do the research and come up with those things, so that I may have taken a different path surgically. I had some long-lasting, forever side effects from my surgery that I may not have had if I had taken my time and gone a different route. So that is the number one takeaway for me, is just take your time and do your research and have your mental health a little bit stabilized before you're making these, gigantic life-altering decisions.
Amazing. Sounds like the theme has been, and I echo this as well, in terms of one thing I wish my patients would know is, again, there's generally time to be thorough and to think a little bit more and to discuss a little bit more. We usually don't have to rush to decisions, and that we should never view ourselves as a physician, being kind of opposite of the patient. We're really all part of one team. So whatever you need, you should feel empowered to ask those questions, to seek that information, to get help with, having a second opinion set up. That should all be part of your primary team's responsibility, and they should be willing and wanting to help you with that. And with that, I'll thank the three of you, and I'm going to turn it back to Brian for some final remarks. Thank you all so much.
Thank you.
Great. Thank you, Dr. Ornstein. Really appreciate you did a wonderful job there moderating. Really appreciate bringing all the perspectives in, and especially thank you to Meryl and to Glenn and to Leah for your insights. Really appreciate you being honest there with what it's been like. I'm really excited to just all the nuggets that were thrown throughout this for folks on the call here today. We're going to have this up on YouTube. You'll be receiving a message in the next week. You can go back and take a look at it to cover up any or pick up on anything you might have missed. Want to also say again, thank you to all of our sponsors. We couldn't do that without you all. Thank you very much. We're going to have our next town hall in October. It's going to be on your oncology nurse, and who's a key partner in navigating kidney cancer care. So stay tuned for something in October. It was mentioned on this, and this is really for the U.S. Folks on the call. I'm sorry for the international folks you have to listen to this, but we could really, really use your help over the next couple of days, weeks, and months. As many of you know, kidney cancer and many, many diseases and research in general has been under attack. It's been decimated in some places. So we're going to come to you, and I know hopefully some of you remember Uncle Sam saying, "We need you." Well, we need you, and we need your voices, and we need your presence and your help over the next couple of months. So we're going to be reaching out to you to see if you can make your voices heard to our legislators and others and our elected representatives to get that funding restored. With that, I want to just turn it over to getting the information on the community social. Again, thank you to our panelists. Thank you, Dr. Ornstein. A great session today. Really appreciate all that you all are doing.
Thanks, everyone.
Bye.
Have a good day.